Question 1. A patient receives a prescription for cephalexin 500 mg capsules. The directions are Sig. 1 cap POTID x 7 days. What is the total number of capsules needed for this prescription? A. 7 capsules. B. 14 capsules. C. 21 capsules. D. 35 capsules. Answer: C. 21 capsules. This question tests your understanding of calculating the total quantity needed for a prescription based on the SIG code. The key information is 1 cap POTID x 7 days, meaning 1 capsule by mouth 3 times a day for 7 days. To find the total, you multiply the number of capsules per dose, 1, by the frequency per day, 3, by the total number of days, 7, which is 1 times 3 times 7 equals 21 capsules. Always break down the SIG code to ensure you calculate the correct quantity for the patient. Question 2. Which of the following tasks is a pharmacy technician legally permitted to perform in most states? A. Counsel a patient on the side effects of a new medication. B. Perform a final check of a prescription order before dispensing. C. Transfer a prescription to another pharmacy. D. Enter prescription information into the pharmacy computer system. Answer: D. Enter prescription information into the pharmacy computer system. This question is about the scope of practice for a pharmacy technician. Counseling patients, performing final checks, and transferring prescriptions are typically duties reserved for a licensed pharmacist because they require clinical judgment and knowledge of medication therapy. Entering prescription data is a common and essential task that pharmacy technicians are legally permitted and trained to perform under the supervision of a pharmacist. Understanding the clear division of responsibilities ensures patient safety and legal compliance in the pharmacy. Question 3. A patient is prescribed Warfarin. Which of the following over-the-counter medications should they be specifically cautioned about taking due to a potential drug interaction? A. Loratadine, Claritin. B. Acetaminophen, Tylenol. C. Ibuprofen, Advil, Motrin. D. Omeprazole, Prilosec OTC. Answer: C. Ibuprofen, Advil, Motrin. This question tests your knowledge of significant drug interactions, specifically with Warfarin, an anticoagulant, blood thinner. Ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, can increase the risk of bleeding, which is a dangerous interaction when combined with Warfarin. While other medications can have interactions, NSAIDs like ibuprofen pose a particularly high risk of additive antiplatelet effects leading to potential hemorrhage. Always alert the pharmacist to any potential interactions, especially with high-alert medications like Warfarin. Question 4. What is the primary purpose of a class imbalance in a pharmacy setting? A. Measuring large volumes of liquid medications. B. Precisely weighing small amounts of ingredients for compounding. C. Storing controlled substances securely. D. Counting solid dosage forms like tablets or capsules. Answer: B. Precisely weighing small amounts of ingredients for compounding. This question focuses on the equipment used in pharmacy practice, specifically a class imbalance. A class imbalance is a torsion balance designed for high precision when weighing ingredients for compounding, typically requiring minimum weighable quantities. Large volumes are measured with graduates, controlled substances require specific storage, and counting is done manually or with automated counters. Understanding the purpose of different pharmacy equipment is crucial for accurate preparation and dispensing. Question 5. According to federal law, which DEA schedule includes drugs with a high potential for abuse and a currently accepted medical use, but may lead to severe psychological or physical dependence? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer: B. Schedule 2. This question asks about the DEA scheduling system for controlled substances. Schedule 2 drugs, like oxycodone or morphine, have a high abuse potential, are accepted medically, but carry a significant risk of severe dependence. Schedule 1 drugs have no accepted medical use, while Schedules 3 and 4 have lower potentials for abuse and dependence compared to Schedule 2. Correctly identifying controlled substance schedules is vital for proper handling, storage, and dispensing according to strict federal regulations. Question 6. A prescription calls for prednisone 10 mg tablets, number 50. The directions are Sig. 2 tablets PO bid x 5 days, then 1 tablet PO bid x 5 days, then 1 tablet PO QD x 5 days. How many tablets will the patient take on day 6 of therapy? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer: B. 2 tablets. This question tests your ability to interpret complex tapering dosage instructions. The directions outline 3 phases: 2 tablets twice daily for 5 days, then 1 tablet twice daily for 5 days, then 1 tablet once daily for 5 days. Day 6 falls into the second phase, then 1 tablet PO bid x 5 days, meaning the patient will take 1 tablet in the morning and 1 tablet in the evening, totaling 2 tablets for the day. Carefully following each step of a tapering dose is critical for patient understanding and adherence. Question 7. Which of the following actions best demonstrates a commitment to quality assurance in a pharmacy? A. Counting medications quickly to reduce patient wait time. B. Regularly checking for expired medications on the shelves. C. Storing all medications alphabetically by brand name. D. Offering discounts on over-the-counter products. Answer: B. Regularly checking for expired medications on the shelves. This question focuses on the principles of quality assurance in a pharmacy setting. Quality assurance involves systematic activities to ensure that services and products meet standards of quality. Checking for expired medications is a direct action to prevent dispensing unsafe products, which is a fundamental aspect of maintaining quality and patient safety. While efficiency and organization are important, ensuring the integrity and usability of the medication stock is a core quality assurance function. Question 8. A patient is prescribed lisinopril for hypertension. Lisinopril belongs to which class of medications? A. Beta blockers. B. Calcium channel blockers. C. ACE inhibitors. D. Diuretics. Answer: C. ACE inhibitors. This question tests your knowledge of common drug classifications for top 200 medications. Lisinopril is a common medication used to treat high blood pressure, hypertension, and heart failure. It works by blocking the action of angiotensin-converting enzyme, ACE, thus belonging to the ACE inhibitor class. Recognizing common drug classes associated with top 200 drugs helps you understand their mechanism of action and potential side effects. Question 9. A prescription for an antibiotic states, take 200 mg POQID. The pharmacy stocks the antibiotic as a 400 mg per 5 ml oral suspension. How many milliliters, ml, should the patient take per dose? A. 2.5 milliliters. B. 5 milliliters. C. 10 milliliters. D. 20 milliliters. Answer: A. 2.5 milliliters. This question requires a dosage calculation based on concentration. The prescription needs 200 mg per dose, and the suspension has a concentration of 400 mg in every 5 ml. To find the volume for a 200 mg dose, set up a proportion, for 100 mg is to 5 ml as 200 mg is to x ml. Cross-multiply, for 100 times x equals 200 times 5, which is 1000. Divide 1000 by 400 to find x, which is 2.5 ml. Always double-check your calculations when dispensing liquids, especially for pediatric patients. Question 10. What is the meaning of the prescription abbreviation NPO? A. As needed. B. By mouth. C. Nothing by mouth. D. At bedtime. Answer: C. Nothing by mouth. This question tests your familiarity with common prescription abbreviations. NPO is a medical abbreviation derived from the Latin phrase nil per os, which translates to nothing by mouth. This instruction is often given before surgery or certain medical procedures. Memorizing common abbreviations is essential for accurately interpreting prescription orders. Question 11. According to HIPAA, which of the following is considered protected health information, PHI? A. A patient's first name only. B. A patient's medical record number. C. The color of a patient's eyes. D. The temperature outside the pharmacy. Answer: B. A patient's medical record number. This question is about HIPAA, Health Insurance Portability and Accountability Act, regulations concerning patient privacy. PHI includes any information about a patient's health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. While a first name alone might not be unique, a medical record number is a direct identifier tied to a patient's health information, making it protected under HIPAA. Always be mindful of patient confidentiality and protect any information that could identify a patient. Question 12. Which of the following medications is commonly used as a statin to lower cholesterol? A. Metformin. B. Albuterol. C. Atorvastatin. D. Warfarin. Answer: C. Atorvastatin. This question tests your knowledge of common medications used for specific conditions. Atorvastatin, Lipitor, is a widely prescribed medication belonging to the statin class, used to reduce high levels of cholesterol in the blood. Metformin is for diabetes, albuterol is for asthma, and warfarin is a blood thinner. Identifying common drugs by their class helps you understand their primary use. Question 13. A pharmacy receives an order for a narcotic pain medication. Which document must be completed by the pharmacist or a designated technician to record the receipt of this medication? A. DEA Form 106. B. DEA Form 222. C. DEA Form 41. D. Patient Profile. Answer: B. DEA Form 222. This question asks about the specific DEA form used for ordering Schedule 1 and 2 controlled substances. DEA Form 222 is a triplicate form required by the Drug Enforcement Administration for the ordering of these highly controlled medications. DEA Form 106 is for reporting theft or loss, and DEA Form 41 is for destroying controlled substances. Familiarity with required DEA forms is crucial for legal handling of controlled substances. Question 14. A liquid medication needs to be diluted. You have a stock solution that is 50% concentration. You need to prepare 100 milliliters of a 10% concentration solution. How much of the stock solution is needed? A. 10 milliliters. B. 20 milliliters. C. 50 milliliters. D. 80 milliliters. Answer B. 20 milliliters. This question involves a dilution calculation, often solved using the formula C1V1 equals C2V2, where C is concentration and V is volume. You have a stock solution, C1 equals 50%, and need a final solution, C2 equals 10%, with a final volume, V2 equals 100 milliliters. Plugging these values into the formula, 50% times V1 equals 10% times 100 milliliters. This simplifies to 50 times V1 equals 1000. Divide 1000 by 50 to find V1, which is 20 milliliters. Practice dilution calculations as they are common in compounding scenarios. Question 15. What is the primary purpose of a drug formulary? A. To list all available over-the-counter medications. B. A list of medications approved for use by a hospital or insurance plan. C. A database of potential drug interactions. D. A guide to identifying unknown pills. Answer B. A list of medications approved for use by a hospital or insurance plan. This question asks about the definition and purpose of a drug formulary. A formulary is a list of prescription drugs covered by a prescription drug plan or hospital, often categorized by tier based on cost. Its primary purpose is to manage medication costs and utilization while ensuring access to necessary treatments. Understanding formularies helps technicians process insurance claims and inform patients about covered medications. Question 16. Which organization is responsible for setting standards for the quality, purity, strength, and identity of prescription and over-the-counter medications, as well as dietary supplements? A. Food and Drug Administration, FDA. B. Drug Enforcement Administration, DEA. C. The Joint Commission. D. United States Pharmacopeia, USP. Answer D. United States Pharmacopeia, USP. This question identifies the key standards-setting organization for drugs in the United States. USP is a non-governmental organization that establishes public standards for medicines, food ingredients, and dietary supplements to ensure their quality, purity, strength, and consistency. While the FDA enforces laws related to drugs, USP sets the scientific standards. Recognizing USP's role is important for understanding medication quality control. Question 17. A medication order reads amoxicillin 250 mg per 5 ml, dispense 100 ml, Sig, 5 ml POTID. What is the duration of therapy in days? A. 5 days. B. 6 days. C. 7 days. D. 10 days. Answer C. 7 days. This question requires calculating the duration of therapy based on the total volume dispensed and the dose. The patient takes 5 milliliters per dose, 3 times a day, for a total daily dose of 5 milliliters times 3 equals 15 ml per day. The total volume dispensed is 100 milliliters. To find the duration, divide the total volume by the daily volume. 100 milliliters divided by 15 milliliters per day is approximately 6.67 days. Since you cannot dispense partial days and the amount dispensed will last just over 6 days, the patient will finish the medication on day 7. Calculate the total amount used per day and divide the total quantity by the daily amount to find the duration. Question 18. Which of the following scenarios represents a potential breach of patient confidentiality according to HIPAA? A. Discussing a patient's medication with the prescribing physician. B. Providing a patient's medication information to their authorized caregiver. C. Leaving a patient's prescription on the pharmacy counter while waiting for them. D. Consulting a drug reference book for information about a patient's medication. Answer: C. Leaving a patient's prescription on the pharmacy counter while waiting for them. This question explores real-world applications of HIPAA principles regarding patient privacy. Leaving a prescription, which contains identifiable patient information and medication details, visible on a public counter risks unauthorized individuals seeing that protected health information. Discussing with the physician or authorized caregiver is generally permitted for treatment purposes, and consulting a reference book is part of providing care. Always handle patient information discreetly and avoid leaving it exposed in public areas. Question 19. What is the term for the process where a pharmacist reviews a patient's profile and medication orders to ensure appropriateness, check for interactions, and verify the dosage? A. Inventory management. B. Medication therapy management, MTM. C. Order verification. D. Compounding. Answer: C. Order verification. This question defines a crucial step in the prescription filling process performed by a pharmacist. Order verification is the step where the pharmacist reviews the prescription details against the patient's profile and clinical information to ensure the medication is safe and appropriate before it is dispensed. MTM is a broader service, inventory management is about stock, and compounding is preparing custom medications. Understanding the pharmacist's verification role highlights the importance of accuracy before dispensing. Question 20. A prescription requires 500 milliliters of a 1:1000 solution. How many grams of the solute are needed to prepare this solution? A. 0.5 grams. B. 1 gram. C. 5 grams. D. 10 grams. Answer: A. 0.5 grams. This question tests your understanding of ratio strength, specifically a 1:1000 solution. A 1:1000 ratio means there is 1 gram, or milliliter, of solute in 1000 ml of the final solution. You need to prepare 500 milliliters of this solution. To find the amount of solute needed, set up a proportion: 1 gram is to 1000 milliliters as x grams is to 500 milliliters. Cross-multiply: 1000 times x equals 500 times 1, which is 500. Divide 500 by 1000 to find x, which is 0.5 grams. Remember that ratio strength can be weight in volume, g/ml, volume in volume, ml/ml, or weight in weight, g/g. Question 21. Which of the following is a common side effect associated with the use of opioid pain medications? A. Diarrhea. B. Constipation. C. Hypertension. D. Insomnia. Answer: B. Constipation. This question asks about a well-known side effect of opioid analgesics. Opioids commonly cause constipation by slowing down the movement of the digestive system. Other common side effects include nausea, drowsiness, and respiratory depression. Being aware of common side effects allows you to anticipate patient questions and identify potential issues. Question 22. According to federal law, how long must prescription records be kept on file? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer: B. 2 years. This question tests your knowledge of federal record-keeping requirements for prescriptions. Federal law, under the Controlled Substances Act, requires that records concerning controlled substances be kept for a minimum of 2 years. State laws may require a longer period, but federal law sets the minimum standard. Proper record keeping is essential for legal compliance and for tracking medication dispensing history. Question 23. A patient brings in a prescription for Lantus Solostar pen, inject 10 units subcutaneously every evening. Lantus is a brand name for which type of insulin? A. Rapid-acting. B. Short-acting. C. Intermediate-acting. D. Long-acting. Answer: D. Long-acting. This question tests your knowledge of different types of insulin based on their duration of action. Lantus, insulin glargine, is a long-acting insulin designed to provide a relatively constant level of insulin over a 24-hour period. Rapid-acting, short-acting, and intermediate-acting insulins have shorter durations and different onset and peak times. Knowing the different types of insulin is important for patient education and understanding administration instructions. Question 24. A pharmacy technician notices a significant increase in the number of prescriptions for a specific controlled substance from one particular prescriber. This observation should trigger which of the following actions? A. Assume the prescriber is handling more patients with pain. B. Report the observation directly to the DEA. C. Document the observation and alert the pharmacist. D. Ignore the observation as it is not the technician's responsibility. Answer: C. Document the observation and alert the pharmacist. This question relates to identifying potential red flags concerning controlled substances as part of quality assurance and preventing drug diversion. An unusual prescribing pattern for controlled substances is a significant indicator that requires attention. It is the technician's responsibility to notice such patterns and report them to the pharmacist, who has the legal authority and training to investigate further or take appropriate action. You are the pharmacist's eyes and ears, so report anything unusual. Question 25. What is the percentage strength, with V, of a solution containing 40 grams of solute in 250 milliliters of solution? A. 0.16%. B. 1.6%. C. 16%. D. 160%. Answer: C. 16%. This question asks you to calculate the percentage strength weight in volume, with V. Percentage strength, with V, is defined as the number of grams of solute in 100 milliliters of solution. You have 40 grams of solute in 250 milliliters of solution. To find the percentage, set up a proportion: 40 grams is to 250 milliliters as x grams is to 100 milliliters. Cross-multiply: 250 times x equals 40 times 100, which is 4,000. Divide 4,000 by 250 to find x, which is 16. Thus, the solution is 16% with V. Always express percentage strength as the amount in 100 units of the total mixture.